All right, everyone. Welcome to week 5 of our onboarding courses. Today, we have kind of a jam-packed schedule. We're going to be going over bunny lines, and we're also going to be going over chemical peels. It's actually probably one of my favorite weeks because I get to introduce an additional tool to your tool belt, and that is the chemical peels. So after this call, you are officially released to start ordering chemical peels and doing them on your patient. So let's go ahead and let's dive right in. Let me do a quick screen share. Okay, so this is week 5. And this is the itinerary that we're going to be going over. Like I said, we talked about bunny lines. We're going to go over chemical peels. I'm also going to kind of talk about some common aesthetic record errors. And then, of course, we have our marketing homework for the week. All right, so let's talk about bunny lines. So bunny lines are formed really because of two different muscles. You have the procerus muscle, remember, that makes up the glabella complex. That's the procerus and the corrugrators. But that procerus muscle is that kind of clam-shaped muscle right at the bottom of the glabella complex, or right at kind of the bridge of the nose. And that muscle can fire one of two ways. It can fire inside each other, or it can also fire kind of like a clamp up and down. If it does kind of more fire like a clamp up and down, you can also kind of get this little line that goes across the bridge of your nose. And that particular bunny line is caused from procerus. But you can also have additional bunny lines that are caused by the nasalis muscle, which is the muscle in the nose. So you can see in this picture, the bunny lines that this particular patient has are formed because of the nasalis muscle and how that muscle is firing. So you can treat it a couple of different ways. If that patient were to have a bunny line caused by procerus, you would really kind of do an additional 2.5 fluid units on either side directly underneath procerus and treat it as a small muscle group. If the patient does not have this and they have the bunny lines caused by the nasalis muscle, you're going to have the patient go ahead and flex those muscles. So kind of, creep up just like a bunny would. And that will give you a little bit more meat to work with whenever you are doing your injections. And you can do either 2 injections on each side or just 1 injection on each side, depending on how far down that nasalis muscle is firing and causing those kind of ridges in the nose. Now, remember that the bunny lines are treated like a small muscle group, so it is 2.5 fluid units into each injection point. So quick recap, you're going to have Botox and Jeuveau. It's a 100-unit vial. You reconstitute Botox and Jeuveau at 2.5 milliliters of bacteriostatic saline. And then you have Dysport. Dysport can be reconstituted. What we do with MFL is 3 mLs. You can also reconstitute it at a hyperconcentrated rate at 1.5. However, if you reconstitute it at 3 mLs for Dysport and 2.5 for Botox and Jeuveau, then this is where the 2.5 fluid units kind of come into play. So regardless of which product you're using, as long as you're reconstituting it at those ratios, at that 2.5 and the 3, then that's where we're getting that 2.5 fluid unit. So that would be into each injection point. Now, for charting purposes, if you are using Dysport and again, reconstituting at that traditional kind of 3 mLs, what MFL does, then you would chart fluid units equal Dysport units. So you would chart 2.5, 2.5, 2.5, and 2.5. If you were using Botox or Jeuveau and reconstituting it at that traditional 2.5 milliliters of bacteriostatic saline, you would go and chart 1, 1, 1, and 1. Because remember your kind of Botox Bible, 2.5 equals 1, 5 equals 2, and 10 equals 4. So 10 equals 4, 5 equals 2, and 2.5 equals 1. So there's a quick little video that we're going to watch on this so we can show you exactly how you inject this as well. So you can see that the injector is having the patient kind of crinkle their nose to give them a little bit more meat to work with whenever they're injecting. And this particular injector is deciding to inject two injection points on each side of that nasalis muscle. She is only treating the nasalis. She is not treating the procerus that can sometimes cause bunny lines as well. So she is only treating that nasalis bunny line. And again, it would be 2.5 fluid units into each injection point. And that is it. So let me go ahead and go back. Any questions about bunny lines at all? Excellent. Okay, so now let's go into the Perfect Derma Peel. And this is about a 13-minute video that you are going to watch. And they're going to go through the entire Perfect Derma Peel and how you apply it and everything.
Welcome to the Bella Medical Products training video. In this video presentation, you will meet some of our corporate staff, receive additional product information, hear testimonials, and view demonstrations of the Perfect Derma Peel application. Founded in 2011, Bella Medical Products is dedicated to formulating innovative, result-oriented skin solutions for the aesthetic medical industry. Ranked as one of the top 3 new anti-aging products of 2011 by ABC News, the Perfect Derma Peel delivers healthy, ageless skin for all skin types and ethnicities. Bella Medical Products advocates the practice of less invasive cosmetic treatments by providing cutting-edge products to plastic surgeons, dermatologists, cosmetic physicians, and other medical professionals. The Perfect Derma Peel and the Perfect Skincare System product line allow us to offer an exciting new future for skin transformation.
The Perfect Derma Peel is my go-to peel for all of my clients because of its versatility for all skin types and skin issues. I love how the Perfect Derma Peel has little discomfort, and with such little downtime, the results are dramatic.
My clients have benefited from the Perfect Derma Peel for several years now. Applying the Perfect Derma Peel is very easy, and our patients are thrilled with the results.
The Perfect Derma Peel by Bella Medical Products is committed to providing skincare products that deliver superior results to the aesthetic medical community. The Perfect Derma Peel is a safe and effective treatment for aging skin and is the only peel to feature glutathione, an antioxidant with powerful anti-aging benefits. The Perfect Derma Peel is available throughout the U.S. and is growing in popularity worldwide.
Hi, my name is Lana Petrovic. I'm the Director of Operations for Bella Medical Products, and I'm going to explain to you some of the benefits of the Perfect Derma Peel. The Perfect Derma Peel will improve the overall clarity, tone, and texture of the skin, reduce or eliminate hyperpigmentation and melasma, control acne, remove or reduce sun damage, soften fine lines and wrinkles, and minimize the appearance of pores. The Perfect Derma Peel is beneficial for all skin types and all ethnicities.
I feel very comfortable using the Perfect Derma Peel because it's very safe, and at the same time it's very effective, very result-oriented.
The Perfect Derma Peel is one of the easiest peels I've ever performed. I've been giving peels for 20 plus years in this business. It's 1, 2, 3 easy. It's a half-hour process. They're fairly comfortable throughout the entire procedure. It's great. They're up, they're gone, they're fine. They absolutely love the result. It's a great thing to do when you're preparing to go on a vacation or a wedding. Anytime you want your skin just to look flawless, they absolutely love the Perfect Derma Peel.
Hi, I'm Michelle Ray with Bella Medical Products. The Perfect Derma Peel is a medium-depth medical-grade peel featuring a unique blend of acids that address many common skin concerns. The peel contains TCA, retinoic, salicylic, and kojic acids, phenol, vitamin C, and antioxidant glutathione. Each acid is under 12%, and the peel is pre-mixed for easy application.
I really enjoy working with Bella Medical because the customer service is amazing. I mean, I've never had any issues. It arrives on time, the product is consistent, and they're really easy to work with.
I am Nafis Sabai, the founder and CEO of Bella Medical Products. We are committed to providing skincare products that deliver superior results to the aesthetic medical industry. We are happy to welcome you as a provider of the Perfect Derma Peel.
Hello, my name is Juliana Wagner. I am a licensed esthetician of 20 years, and I'm also the senior trainer for Bella Medical Products, and we're here to do the Perfect Derma Peel today. So Natalie has concerns with fine lines and wrinkles, so we're going to do the Perfect Derma Peel on her today to bring back that healthy glow to the skin. So what we prep the skin with prior to the peel is 100% pure acetone. It degreases the skin so that the peel gets down into the skin evenly and deeper into the skin as well. I'm going to have you hold your breath and tuck your lips, please. Any areas of concern, such as fine lines and wrinkles, as well as hyperpigmented spots, deeper lines, you want to be more aggressive with your acetone in those areas, again, to get that peel down in there to do a better job. A good 2 to 3 passes is necessary. Next, we're going to go ahead and put the peel into the cup here. And you're going to want to apply it with one of the 2x2s that come with the peel. And you're going to fold it into a little bit of the square. In our first pass, we're going to go lightly just to numb the skin. How are you feeling, Natalie?
I'm good.
Good. So the active ingredients in the Perfect Derma Peel is the TCA, salicylic, retinoic acid, vitamin C, glutathione, kojic acid.
It's kind of typical now.
And with the phenol in there, you don't have to have the pain.
Yeah.
We're going to feather into the neck 1 to 2 layers, and directly underneath the eye 1 to 2 layers as well. I'm going to have you look up towards me, please. And go ahead and close and relax. You're going to layer the peel till it's gone. You're going to look for frosting as your end point, as well as erythema. You want to redip often into the cup so that it stays nice and even throughout the peel. I'm going to have you look up towards me, please. And that'll be the last layer underneath the eye as well into the neck. And then we'll finish the peel throughout the rest of the face. Almost done here. And you just want to work it through once your cup is empty till your gauze is practically dry. And that's it. As simple as that. So next, we're going to go ahead and go over the post-peel kit with Natalie. Natalie, the peel is supposed to be left on in 6 hours. It self-neutralizes. So you can wash your skin in 6 hours, but preferably I'd like you to go ahead and leave it on overnight if you're not uncomfortable in any way. In the morning, I'll have you wash with a very mild cleanser, and then you're going to go ahead and I'm going to recommend that you take one of the 2 towelettes that are in your post kit. I'm going to hand you the directions as well. And this is a towelette that you're going to use on clean, dry skin tomorrow morning. And this has vitamin A, so it's going to help to expedite the peeling process. So we'll go ahead and you'll use the towelette fairly aggressively. You're going to rub throughout, make sure you get under the eyes really well, and also feather it into the neck. You're going to go ahead and wait at least 30 minutes before applying any sunblock on top. And then you're free to wear makeup that day if you choose. Then that evening, I'm going to have you go ahead and I'm going to have you cleanse again with something mild again, and then go ahead and use your second towelette. And again, very aggressively, you want to rub it throughout the face, feather it into the neck and under the eyes, and then just go ahead and sleep with that on overnight. Okay? Then after that, the next day you're going to start to see that you're going to start to peel around the mouth. And that's where we talk and move our skin the most, so it'll peel first, and then it's going to kind of just slowly peel out for you. So during that process, you're going to use the hydrocortisone 1% cream that's in the kit as well, and that's all you'll need along with your sunblock. Okay, and then it is a 7-day process, and then you're going to just look beautiful and glowing as you naturally are.
Thank you so much.
All right, thank you. Prior to the application of the Perfect Derma Peel, it's important to go over the contraindications with your patients. Contraindications include pregnancy, breastfeeding, Accutane use within the last 12 months, hypersensitivity to any of the peel ingredients, or aspirin allergy. Do not apply to skin that is still irritated from any harsh treatments such as lasers, waxing, electrolysis, or chemical exfoliants. Do not apply to open wounds, sunburn, infected skin, cold sores, herpes, or lesions. It is important to advise patients with a history of cold sores to be given an antiviral prior to the peel. For overall rejuvenation, we recommend doing the peel no more than 2 to 4 times per year. However, for chronic conditions such as acne, hyperpigmentation, melasma, and concerns with fine lines and wrinkles, we do recommend a series of 3 peels 30 days apart. For thicker and more resilient skin types, melasma, and acne scarring, we recommend adding the Perfect Derma Plus Booster to the peel solution for optimal results. The peeling process will vary per person based on skin type and skin condition. The peeling process will start within 48 hours, intense peeling for 2 to 3 days, and an additional 2 days remaining with the residual around the hairline and neck areas.
If you have any additional questions or need more information, please feel free to contact your local sales rep or our corporate headquarters.
Okay, so that is the Perfect Derma Peel. And it is a really, really great peel. It is considered a medium grade medical peel. So the patient does not have to be sedated for it. They don't have to be numbed. It is self-neutralizing, which is great because you can do it at a Botox party. You can run to your patient's house and put it on, and then they can kind of go about their day. Since it is self-neutralizing, it does need to be left on for a minimum of 6 hours. If the patient can tolerate it and can leave it on overnight, that's even better. I usually get about 6 hours after that, and then I start to get pretty uncomfortable, and then I will actually just go ahead and wash it off. And then the next morning, I will use the towelettes for it. So then you'd use the towelettes in the morning, and then the towelettes in the evening, and then you can kind of continue your normal skincare routine after that. It is a peel, meaning you will actually peel. My best advice to all of my patients is do not pick at it. I unfortunately I'm a picker, and so it was really hard for me to not want to pick, but the skin underneath the skin that was peeled off was like baby soft. So it didn't have any of like the sun damage that I had had from my youth. It does get rid of fine lines and wrinkles. It's a great chemical peel to kind of have in your tool set. So any questions about the chemical peel?
I have a question. How is it stored?
Uh, in just your bag. It doesn't need to be refrigerated or
Okay.
anything like that. Yep.
Just room temp is fine? Okay.
Yep, exactly.
Okay.
And then we do recommend that you try the peel before you do it on a patient. That way you can kind of speak from personal experience. So if the patient calls you and she's like, oh my gosh, I'm itching, you're like, girl, I know there's a hydrocortisone cream.
Right.
Yeah, in the pack, use that. So that way you can kind of speak from experience of it as well. So you can kind of know what to expect. But I do it on myself probably 2 to 3 times a year. And I've done it on my daughter several times just for her acne as well. But really I do, probably 2 to 3 times a year is kind of what I recommend for my patients. I'll, do microneedling, and I'll skip a microneedling and do a chemical peel. So we're just kind of continue to kind of keep that skin fresh and that cell turnover kind of continuing to kind of get rid of those fine lines and wrinkles.
Okay.
Okay, so let's talk a little bit about aesthetic record. So these are some of the kind of big pitfalls that I see whenever injectors kind of call us for questions about aesthetic record. It says, how often can they use the hydrocortisone cream? They can use it, I believe, up to 4 times daily, but on the pack, on the insert, it will say twice daily, but you can actually use up to 4 times daily. So in the morning and the evening, but I also used like a petroleum jelly that kind of helps, like Vaseline. Vaseline makes it feel significantly better as well. So going back to aesthetic record, as far as some of the big pitfalls, the big thing that I always see is when injectors forget to use the correct tier or the correct variant. So what that means is if a patient gets 40 of Botox and they actually qualify for a tier, the injector would accidentally forget to go to that variant and then choose that Botox variant or that Botox tier, and they would just charge them the regular product. And it's significantly more expensive that way if you do forget to do it. So if you do go all the way to the checkout portion and you see that you have accidentally chosen the wrong tier and the patient should be getting a discount, please do not check out. You cannot go back. Once you've hit that checkout button, you cannot edit the chart. Unfortunately, that is a limitation of aesthetic record. Once you hit that checkout button, really nothing can be added or subtracted. The system just does not allow that. It kind of freaks out, because then if you try to go back in and add and delete things, it's just essentially just continues to add them. It won't take it off. So my best advice to you, if you've accidentally hit that checkout button and you're like, oh my gosh, this looks like, it's $200 more than I thought that it should be, or that I quoted the patient, delete the chart and start over. It will take you an additional 5 minutes. It's okay, but I promise you it's not worth the headache in the future. So please make sure that you are choosing the correct tier or variant. That way you don't run into that. But if you accidentally do choose the wrong one and you do hit that checkout button, delete the chart and start over. So that's kind of the big thing. And then also we get a lot of questions on what's the difference between like a finesse treatment or someone who's just needing more product. So a finesse treatment is more like you accidentally caused a little bit of a spot eye, or they have just a little bit more movement, or they have a little of a drop brow. So you can go in there and you can add a little units here and there, and that is totally covered. The patient does not have to pay additionally for that. But let's say you sat down with a patient and the patient's like, okay, I want to get my Levens done. I want to do my glabella complex, but I'm on a budget. I really don't want to do 50 units of Dysport. Can we just do 30 units of Dysport? And you're like, absolutely. You're going to educate the patient. You are still probably going to have some movement in there. As long as you're okay with that, just know that. Great. Well, let's say 2 weeks later, they reach out to you and they say, hey, I still have movement. I think I need more. They would have to pay for those additional units, but that makes sense because they elected to not have that full treatment. And that's really where in your charting platform underneath AR, that's really going to help save you a lot of headache as well. because you can go in there and you can put patient elected to do less units due to budget. We'll kind of continue to monitor after that. That will save you a lot of headache in the future. So please just make sure that you're documenting those conversations that you have with your patient, just like you would in any hospital setting. Any questions about some of the aesthetic record pitfalls or the difference between a finesse treatment and just needing additional more units? Excellent. Moving on. Okay, so it's going to bring us to our final page, and this is our marketing homework. So this one, it's always kind of a big ask this week whenever I do this. And, when you look at your network of family and friends and acquaintances and neighbors and kid mom friends and all of those people, they are all kind of considered your warm market. So to get out of your warm market, you have to make a drastic change. So this is the week that I ask you to kind of step out of your warm market and start looking into a cold market and start tapping into other people's markets. This is where we ask you to join a networking group. There are so many different networking groups around the big major cities. They can be in person, they can be virtual, they can be on social media platforms. They're really everywhere. And it's a great way to reach additional people and to reach additional networks. So you have to put yourself out there. Remember at the very beginning of this, I kind of talked about getting comfortable with being uncomfortable. And this is like a big ask. This is where you are going to grow yourself as an injector and as your injecting business by reaching out to additional people. And this is where you can, say you meet someone at a networking group and they own a salon, you can go and talk to that salon owner and say, hey, let's partner together. And really that's how these kind of relationships get started. The second part of your homework this week is you are going to post a before and after of a chemical peel. I already have that graphic for you, so I will go ahead and post it on the Facebook page. So it'll be super simple just to grab and to post on your social media page. And the very last post that you're going to do this week, it's going to be an education post about the benefits of chemical peels. Remember, the purpose of this homework of you posting on social media is so that you can build your brand and you are positioning yourself in your warm market as an expert in this field. And in order to do that, you have to continue to kind of post and have new content. You can have some funny gifts, you can have some education things, you can have some live pictures. You don't just want to post, pick me, pick me, pick me, pick me. You want to give them a lot of different content so you can build yourself as that expert within this field. And then you're going to continue your social media following. Again, you need to continue to see how other injectors inject so you can learn from them and you can gather all of those resources and gather all those tools so you can figure out which way works best for you. The 3 additional people that I want you to follow, the first 2, they are injectors and they're really, really good injectors. They are considered advanced injectors, but it's a great way to see how other injectors do some different procedures so you can get familiar with. And then I'm always here if you ever have any questions about any of the skills that they were doing, and I can kind of help walk you through that. And then the very last one, so this is a podcast. Her name was Jessie Lee. She actually passed away not too long ago, but she was a big network marketing guru. She was kind of the best in the business and was just extremely successful. But she has a wonderful podcast as far as kind of getting comfortable with being uncomfortable and just putting yourself out there and how to be an entrepreneur and how to push yourself. So if you really want someone to kind of kick you in your butt as far as kind of launching your business and launching yourself as an entrepreneur, because that's really what you are when you are starting and injecting when you're starting an injecting business, or when you are, going into a brand new field, is you are an entrepreneur, and she does an excellent job of teaching you kind of how to do this. Because unfortunately, medical people, especially nurses, we are just not taught how to do this. And I have learned a lot from her. She really was a wonderful asset, and she was a wonderful person and a great resource. The world really did lose kind of a light when she passed away, but her knowledge is definitely being passed on, and people can continue to learn from her. So I highly recommend this podcast. If you have any other recommendations for additional podcasts, please share them on the Facebook page. I love listening to new people to talk and to help all of us kind of grow as a community. So please post that. But those are the kind of big homework assignments this week. Again, that's join that networking group, post that before and after that chemical peel, do an education post on chemical peels, and then you have your kind of 2 additional people to follow, and then your podcast as well. I'm going to go ahead and I'm going to end the recording for this week, and I will see everyone at week 6 next week. But if you have any questions, please stay on and I will answer all questions after this call. I'm going to go ahead and I'm going to stop recording.